And generations and generations, young boys, we've been told you got to man up, right? Something going on, just man up, suck it up, deal with it, right? And that's when dealing with mental health struggles. But experts say that kind of approach, it just doesn't work. And here to talk about how men should address mental health is our friend, psychologist, Dr. Rich Hall. Dr. Hall, before we even started today in the commercial break, I was about to say a thing, and I almost prefaced it with that very idea that, you know, I don't want to suggest there's a problem because I want to be the one to fix it.
Right.
And how often do you find that with men who you talk to in your practice?
Very often.
Yeah.
It's the idea that they often come a little, not necessarily too late, but very late in the process of their issue because they kind of feel like they should just already know what they're supposed to do, that there's no one to ask, that they have to be responsible and accountable for themselves. So they don't know how to, or they feel like you kind of said, silly asking for help from someone.
Because we're the fixers, right? There's a problem, I fix the problem.
Right, absolutely.
You know what I mean?
Absolutely.
Don't tell me there's a problem and not expect me to fix the problem. That's my thing, I fix the problem.
That's where we go immediately.
That's right, and you don't necessarily talk about because you'd rather just do.
Just do, right.
Yeah.
Be a human doing as opposed to a human being, right? So the idea of stopping to self-reflect what's going on with me actually feels like it'll slow down the process.
Yeah.
But in reality, that's where I often encourage people to do that check-in to see, do I have the resources? Do I have the knowledge, right?
Yeah.
I'm not a car guy, right? So if I'm staring at anything going on with a car, I can do 3 things with the car. And some of them are a little bit more expensive. I can change an alternator on the right car, right?
Yeah.
But there'll be times where if I look in there and I'm like, well, it's way down in there. I can't get there myself.
I don't have the right tools for that.
Right.
Yeah.
I know I got to go to somebody else to solve this problem.
Someone who has the tools.
Someone who has the tools, has the knowledge, and will not break something like I would by myself.
Is it a fear of showing weakness too?
Often, yes. It feels like vulnerability, and vulnerability feels bad because it means I'm weak and not just I need to open up to the right person.
Yeah.
Because a lot of times, once again, for men, when we were vulnerable, even growing up as children, it's man up. What are you crying for?
That's right.
Get back on that bike and, get down the road.
Right. Rub some dirt on it.
Right. Rub some dirt on it. You'll be okay.
This is a stat that is very scary for men, and that is nearly 80% of suicide deaths in the U.S. are men. How? Why? How did we get? Not that it would be better if it was 50-50. I'm not suggesting that.
No.
But why is the percentage so much higher for men?
Unfortunately, men tend to choose the more lethal means. So men are more likely to use like firearms or something that you get one shot at that and literally you've completed a suicide. And they often feel like there is no one that they can ask for help or no one that will show the empathy or sympathy. Like there's a lot of studies that showed that men they can go literally weeks without any sort of physical touch whatsoever. And so we kind of socialized men to not know that there are people who are there to listen, there to care. And to feel like they can reach out, unfortunately. Yeah. And so a lot of us, therapists like myself, other people who are in prevention and intervention are trying to get the message out that there are people who are listening, are people who are willing to care. There are hotlines, text lines, all these things online that you can use.
And there doesn't have to be stigma, there doesn't have to be shame.
No, that these people are there to actually listen to you, give you an ear for some time so that you can feel like you've connected with someone.
I touched base with you at the beginning here before we even got out of the commercial break about what I think is it's a difficult and complex dance, and that is, as a dad, for me, I want my kids to have grit. I want them to be tough. I want them to push through certain things. Where does that balance come from between sometimes you got to learn to deal with stuff that's not so great, and by golly, make sure you're taking care of yourself, because that's a hard line.
It is. It genuinely is. So we want our children to have resilience. We want them to be able to face challenges and overcome them. But we don't want them to completely ignore their feelings, right? The way I was taught, 70s, 80s, 90s, why are you bringing feelings into this? You got to climb into that hole, right? What we have to do is take the opportunity afterwards to still spend some time self-reflecting on it. How did it feel? Notice that remind them of the message, you still got through that thing. And I had to push you as your father, even though I was worried for you, but we both had to do this together, right?
Yeah, we were still checking in on it.
Right. So the idea that you could still push them to do the thing, push them through the challenge, but also take the time afterwards to just talk about what happened and how it felt and what went on.
Talking. Men, we're always so good at that.
Right.
We're always so good. Dr. Hall, I appreciate this conversation. I think it's a really important message for men to hear, that it's okay to seek out help and seek out somebody you can talk to when you need it.
Right.
Appreciate your time.
Always a pleasure.
And I think we're going to have you back before too long. We do want to remind everyone watching that if you feel that you are in a mental health crisis, there are resources for you. We mentioned it earlier this hour, but you can reach out to the Suicide and Crisis Lifeline right now if you're having issues. 988 is the number to call, 988, and that hotline is staffed 24/7. It is free and it is confidential.
Hey there. Yeah, you could stop watching right now, but let's be honest, you don't want to do that. Hit the links or click subscribe to see more amazing content from all of us here at Local 12.